Start.
Hello,
Hello.
this is Dr. Gabrat, doctor in the General Medical Clinic. Are you Mr. Donald Trump, 64-year-old?
Yes, doctor, I am.
Okay, Mr. Donald, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So before we start, can I know how much you know about your condition?
Actually, doctor, I had cough for last few months and also developed shortness of breath. For that, I visited my GP. He did a chest X-ray and said that there is something abnormal. After that, he sent me here. And in your hospital, they did extensive X-ray of my chest, and they also take some uh, tissue from my lung. And they said that they will inform me after the test results come.
So, Mr. Donald, the result all with me now, and I'm afraid to tell you that the result doesn't come as we hope.
What do you mean by that, doctor?
Mr. Donald, I'm sorry to tell you that, but the result of your lung tissue come and confirm a diagnosis of cancer.
Cancer? I have cancer, you are saying that?
I'm sorry to confirm that, but Mr. Donald, you have the result showed that you have cancer in your lung.
Doctor, I have only cough and shortness of breath. Are you sure? Are you mixed up someone else person's test with me?
I appreciate your concern, Mr. Donald, and I appreciate the fear you are now, but I confirm your name and your result twice, and I'm sure that the result for you showed lung cancer.
So I have cancer, you are saying that?
I'm sorry to predict this news, bad news for you, but you have right to know about your diagnosis.
For after a long time, I was so much depressed, and after a long time I am seeing the hope of life, and at this time you are saying that I have cancer.
I'm so sorry for the bad news, but Mr. Donald, let's discuss your condition and what we can do further. Do you want to know more about your diagnosis?
Okay, doctor. What can you do for me? I have cancer. Am I going to die?
Mr. Donald, I'm so sorry, but I cannot predict this. This question very difficult to be answered. But you have serious condition. There is treatment available, but the result not. We cannot expect the result. So,
what are we going to do with me now, doctor?
Mr. Donald, now after confirmation of the diagnosis, we need to refer you to a group of specialists. They will study your condition further. They will do for you multiple imaging and investigation to see what they can do further. So I will refer you to this group of specialists, especially the oncologist and the lung surgeon, and they are in better position to inform you about the plan. But there is a possibility. Do you want to know more about the possibility of management?
Okay, doctor. So is there any hope that I will live?
I'm so sorry, Mr. Donald, but this question very difficult to be answered. But the treatment available, we will offer you the treatment, and it depends on the response of your body. Many person have cancer like you. They underwent the management and they improve. On the other side, there is many deteriorate. There is too many deteriorated and has deterioration of their symptom. It depends on the management and the response of your body. Do you want me to explain to you anything more?
Okay, doctor, I have cancer and you are going to refer me to some other doctors. And when are you going to do that?
Mr. Donald, this will be as soon as possible. Right now, I will write letter for the concerned doctors. They will do for you all the investigation and they will start managing you.
Okay, doctor. Do you think that I need to go for any other further treatment to be sure that I have cancer or not? I cannot believe, doctor.
The result confirmed, Mr. Donald, and further investigation, it's your right, but it will nothing will do
Time
rather
off.
than delaying the investigation and treatment.
Okay, thank you. So,
Okay.
what was your task?
My task was to explain the diagnosis of lung cancer.
And what do you think? Have you been able to do your job?
No, I only predict the bad news and I don't explain the cancer.
Okay, don't worry for that. Patient wasn't so much eager that what type of foods or what happened. He didn't want to know so far. And can you tell me the ethical issues of communication?
The ethical issue, the autonomy that the patient has the right to know his diagnosis and to accept or reject any treatment. The beneficial that we do all good for patient to in order to treat him and do the best for him. Non-maleficent, not to do harm for the patient,
And
and
what is the non-malfeasance issue here in this case?
that we don't do harm for the patient. Like if we repeat the investigation again, we'll delay the treatment.
Okay, fine. Thank you. You have done it very well. And what are the legal issues here?
Legal issue, we can apply here confidentiality,
Yes.
uh, consent for treatment of cancer.
Yes. Excellent. And can you tell me that if it were anyone else, suppose patient's relative, could you send the message of having lung cancer to his relatives?
I didn't get the question.
Okay. Suppose patient's son has come to you and want to receive the
Yes,
investigation reports and also
yes,
want to know the
yes,
diagnosis. At that point,
yes.
could you or would you deliver
I,
the message of lung cancer to his son?
I, I should take permission of the patient first.
Okay, that's fine. And every case of lung cancer, the patient have asked you that is he going to die or is there any curable treatment?
There is treatment available, but we cannot predict the result. Patient may improve or deteriorate.
Okay, that is fine. And suppose this patient has lung cancer and it is of advanced stage. So what could you do for him?
I should ask for him the advance plan, the future plan,
Okay,
and it depends on the plan of management from the treating team if they decided not to do surgery and to do palliative care.
okay, fine. Thank you. You have done excellent.
Sorry for my miss. It was missed it totally, and I was surprised why I have too much time because I don't do the main task.
No, 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 no. Whenever I asked the patient that what was his diagnosis, you said lung cancer. It was fine. He didn't wanted to know more about the lung cancer. He was more worried about that he is going to live or he is going to die. And, rather, he was going to know that what will happen to him now. Okay. And for the so in such cases, suppose we approach like this that I ask the patient about his symptom and how is he feeling now, and after that we say that yes, all your test results are in my hand. Do you have any idea what could be the cause of your symptoms or what could be the test results? The patient will say no, I don't have any idea. Okay, do you want me to explain the explain the test reports? And after that patient will say yes, please tell me what is happening with me. After that you can say that okay, the test results came bad, actually it is very bad. And it is not proportional to say that as we hoped or as we expected. This doesn't mean this means that you expected something else, and you are not expecting anything. Just say that okay, these results came bad. And I think that avoiding such words like we didn't expect, we didn't hope, we didn't expect, or we didn't hope this, or it is out of our expectation. I think you should
This what
avoid this word whenever telling a diagnosis of cancer or anything else. Just to simply say
that
that okay,
was
test results came bad, actually it is very bad. Then after that, give a pause for a few seconds and then say that okay, test results say that you have cancer in your lung. I am sorry to say that. Okay. Yes, we hope that means that something unprofessional to me.
this what we learn from the all instructor. This the way of breaking the bad news.
Okay, and I have learned that never say it is somewhat unprofessional that we didn't expect this, we didn't hope this. Okay, so and otherwise everything was fine. And one thing that you mentioned some medical terms.
Lung
Uh, I forgot to write that. And, there was you use some medical terms like oncologist.
la-
You said that you are going to refer me to the oncologist,
oncologist. Yeah,
not oncologist. That's cancer doctor.
cancer doctor. Lung is allowed. Lung
Yes, lung is a jargon uh, that is known to everyone. Okay. Otherwise, everything was fine. And for the diagnosis of lung cancer, what is cancer? It is almost known to everyone that cancer is a bad thing. It is. So if he doesn't want to know more specifically, you shouldn't give much emphasis on that. That I have to explain the term cancer. That is not so much necessary. After you said that cancer patient assume that he has cancer and this is something bad. So don't worry for that. Okay.
okay.
And this was
Uh,
actually fine. Did very
regarding
well.
as you said, when I start the conversation, I should ask regarding the symptom. How is doing?
Yes.
Uh, I I I skip it, but
No, no, no. It is not a big deal. That
no, I
avoid.
skip it but for reason that we have short time to manage all the concern. Is it necessarily to do it? Because I skip it by
No, just maintaining a repo. It will only cut only few seconds, like 10 to 15 seconds.
I decided to skip it so I will save more time for managing concern later.
Okay. You can do it, but it will not kill it much of your time. Rather, it will give some option to explain later that how do you sure that I have cancer. Then you could say that you have shortness of breath, you have cough, and all the test reports that came. So it is confirmed that you have shortness of breath.
Mm-mm.
Let's start.
Hello,
Hello.
this is Dr. Rabra, doctor in the medical clinic. Are you Mr. Donald Trump, 64-year-old?
Yes, doctor, I am.
And how can I call you?
Please call me Donald.
Okay, Mr. Donald, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor.
So I understand that you came with cough and shortness of breath and some investigation done for you. So
Yes,
how are you doing now?
doctor, my condition is deteriorating, and I think that I am becoming more shortness of breath, and I have more cough. Actually, this is some worrying and something bad for me.
I'm so sorry to hear about that. We will try our best to help you in this regard. Is that okay?
Okay, doctor.
So, Mr. Donald, uh, uh, there was investigation done for you, and your team, managing team, did for you the investigation and imaging in order to uh, assess you better. But unfortunately, the result came and evidence that your condition is deteriorating and you have advanced stage of the disease. Are you with me, Mr. Donald?
Yes, doctor.
I'm so sorry to deliver this news, but as at this stage, we will treat you with a group of specialists called multidisciplinary team to treat you with palliative care. Have you ever heard about palliative care?
No, doctor. What is this?
This a type of treatment that you will be treated under multi-speciality. They will treat your symptom in order that you will not feel pain or you will feel less pain. They will treat all symptom you have, like if you have shortness of breath or secretion or tiredness or any symptom you have, they will treat it in the best way. But I'm so sorry to tell you, but your lung cancer have no cure, and there is no operation can be done for you. Are
So
you with
that you
me,
are
Mr.
saying that
Don?
you cannot do anything for me.
I appreciate your concern, Mr. Donald, but as I told you, there is no operation can be done, but instead we can do the best treatment for you in this stage is the palliative care. We will treat all your symptom, all your suffering, so you will not feel any pain.
Okay, doctor. So I heard that there are some therapy that is available for the cancer patient and that can cure the patient. I have seen one of my relatives. He also had lung cancer, and after doing a operation, giving some therapy, something called radiotherapy, he was fine. Why are you not going for that?
Uh, um, I appreciate your concern, Mr. Donald, but as I told you, uh, the treatment varied from one to one, and not the all cancer treated in the same way. For that, your treating team they do for you the imaging and the investigation to see in which stage you are. In your stage and in your condition, the 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 radiotherapy and the surgery doesn't help because you have advanced disease. I'm sorry to tell that.
Okay, doctor. So that means that I am going to die soon.
Mr. Donald, no one can predict that, but people with the same condition have shorter life.
Doctor. 1 week remaining.
So, Mr. Donald, have you ever think about your future plan? Like, if you have any wish, if
Yes,
you
doctor.
want to assign anyone in your behalf to decide
Yes, doctor.
in
I will do it as soon as possible. And do you think that I can become so ill suddenly?
something like this expected in any time because your disease deteriorating and you should expect anything anytime. So if you need any help in or any information in this regard, I will refer you to the specific person to help you in
Time
this
up.
regard.
So what was your task?
Again, to explain the management, which is palliative care.
Okay. And what do you mean by palliative care?
Palliative care, it is a type of treatment that aim to reduce all symptoms of the patient, like pain, like distress, shortness of breath, to reduce symptom, so
Okay.
patient will not suffer any symptom.
Okay. And what do you think that have you been able to explain the term palliative treatment to the patient?
I think so, yes.
And who is involved in the palliative team therapy? Do you have any idea?
Yes, it is a group of specialists, including the specialist nurse called Macmillan nurse, the, the specialist in the palliative care, nutritionist, social support service, social service.
Okay. And suppose, do you have any idea about euthanasia?
What is this?
Euthanasia.
What is this?
Okay, don't worry about that. And this palliative therapy, and suppose this patient is on palliative therapy, and suddenly he developed a condition that cannot be reversed. Suppose this patient has developed cardiorespiratory failure,
Yes.
and at that time, who will take decision on his health issue? Suppose this patient have no advance directive.
The medical team will decide, most likely will decide for the
Okay, and
in our
suppose this
system.
patient have advance directive. So what will you do at the stage?
If, the medical team, the decision will be relying on the medical team at this stage.
Okay, that is good. And suppose this patient has developed shortness of breath at any time. Suppose he is at end stage of his life. Do you know any medication that can help this? That can help
Yeah,
him?
will support his breathing by oxygen, by managing the airway, and by morphine.
Okay, fine. Thank you.
Thank you.
In this case, you have done very well. And one thing that you haven't asked the patient about his condition if he knows anything first. And you voluntarily said that the patient has cancer and it is of advanced. Okay.
Yes.
First, after building the repo, that okay, how do you feel now? Do you have any idea what is happening with you? And after that, the patient would tell that yes, they said that I have cancer and I don't know that what is the management plan for this, or they may say that he doesn't know anything. Unlikely he will say that he doesn't know anything. He will say that I have cancer and I uh, I am here to know about your management plan. You haven't asked the patient if he knows his diagnosis at all or not. You should have asked this, that do you know what is happening with you, or do you know what is
Yeah.
your condition or what is your disease. Okay.
Sure.
And after that you could say, okay, I am sorry to know that you have cancer, and again I am sorry to tell you that your cancer is has spread it yep, to other parts of body, and for this you have been reviewed by the management team, and do you have any idea that what can be done at this stage? Then the patient would say, no, I don't have any idea. Then okay, at this stage, no medicine or no surgery is beneficial for you, that it will not bring any benefit for you. That doesn't mean that we are not going to do anything for you. We are going to give you uh, therapy that is called palliative therapy. Okay. Then do you have any idea? And if you told me this, then I will not ask you that why aren't you going for the surgery? Why aren't you going for the chemotherapy?
Is that acceptable in that I said your result showed that you have advanced stage of the
Yeah,
disease?
yeah, that was fine. But one thing that you haven't asked that patient, if patient knows that if he has cancer or not.
Yes.
Patient would say, yes, I know I have cancer and I want to know that what can you do for me now. Then you can go for any other stage, because you haven't asked the patient's if he knows the diagnosis or not.
Yes.
And you assumed from the previous case that patient knows his diagnosis. I think.
Yes, and another thing that because I want to ask the symptom and build the report, so I miss the asking
No, you have to
side.
just the asking for the symptom is also important for this stage, because patient has having there is chronic deterioration of his symptoms, like he is having more cough, more shortness of breath. Okay.
Mm-mm.
So that asking for the symptoms is necessary here, so that okay, we cannot do any surgery, or we cannot give you any chemotherapy or any special medication or a special therapy, but we certainly can do thing for you, and that is called palliative therapy. And in this we are going to reduce your symptoms, like that you said that you have cough, you have shortness of breath. We can certainly do something for you, so that you will not feel so much distress. Okay.
Okay.
And everything was fine, just you should have asked about if the patient knows what is his diagnosis. Otherwise everything was fine, and you were so specific and to the point that you what I wanted to know, uh, you have explained that well, and you are not giving any false hope, you are not giving any wrong information. You were what you don't know, you said that I don't know, and the special team will be able to say that. That was extremely fine. Okay.
Thank you.